Replace study has been designed to assess the propaten graft for the treatment of CLI patients for below-the-knee bypasses in case when the vein conduit is not available. And so we compare the propaten graft, which is a heparin-bonded graft, versus the regular ePTFE graft from W.L. Gore. Replace study is a robust study because it's a randomized controlled trial. We have to include 228 patients, so it's a large cohort of patients. It's a one-to-one randomization. And in this study, we schedule 3 years to include this patient because, as we know, in most of the centers, the first approach to treat CLI patient is endovascular treatment. And when endovascular treatment fails or when endovascular treatment is not possible, usually the interventionalist choose bypass to make the revascularization of this patient. And in almost 70 to 80% of the cases, we can use vein conduit to perform the bypass, but in 20 or 30% of the cases, it's not possible because the vein is not available. And so we decide, in this case, to use a prosthesis. And as we know, the regular prostheses are not so good to achieve good results in terms of limb salvage in this patient. It's why we have to improve the technique, improve the devices, and probably propaten is a good way to improve the results and to save more limbs for this CLI patient. So far, we have included 96 patients out of 228 patients. So the inclusion rate is pretty good, and we expect to finish the inclusion rate as we scheduled in February 2021. After that, we have to follow up the patient, of course, but we will do interim analysis for the first patient, and probably next year we will be able to release the first results of this interim analysis. Claudicant is related to flow improvement, but is not just the case for CLI patient. We have so many factors, of course, the flow, the quality of revascularization, but also we know that CLI patients have other issues, such like infection, such like diabetic control, such like orthopedic problem. So we have to deal with all these parameters to improve CLI patient, but again, improvement of the flow is not the only factor to save the limb in this patient.